my name's Haley. I'm going to be taking care of you today. I've washed my hands before I got into the room. I looked at your vital signs outside, noticed that your blood pressure is 120/80, your pulse is 86, your respirations are 16, and your temperature is 98.6, which are great and well normal within your age limit. I'm going to notice that your gait when you walked in was symmetric. You didn't look like you were off balance nor weak in any parts of it. I'm noticing that your stance while you're sitting in the chair is appropriate. You're looking at me when I'm talking to you. Your back is up straight with a little round at the top. And I think we're going to begin our assessment by you telling me your name and date of birth, please.
Luke Hummer, date of birth 3/24/97.
Great, thank you. I'm noticing your articulation is appropriate. You're answering my questions appropriately. And you're speaking in your native tongue of English. Now I'm going to ask if you're in any pain today.
No.
Great. Now I'll begin my assessment. Can you tell me where you are today?
Savannah, Missouri.
Great. Can you tell me what the date is?
12/1/18.
Great. Can you tell me who the President of the United States is?
Donald Trump.
Great. Thank you for answering this question. Now I'm going to look at your hands. I'm noticing they are pink, warm, moist, and soft. I'm noticing at your nail beds they are well rounded without any cracks or bleeding. Your cap refill is under 2 seconds. Your radial pulse is 2+ bilaterally. I'm noticing that there is no edema, bruising, lesions, or nevi. It looks great. Your skin turgor, great. No signs of dehydration or tinting. Now I'm going to move on to feel your head. I'm noticing that your hair is well grown. There's no signs of patchy hair loss or anything like that. I'm going to feel. I don't feel any depressions nor bumps or bruises. Do you have any tenderness when I'm feeling your head?
No.
Great. I'm noticing no infestations or abnormal findings. Great. Now I'm going to test your eyes, noticing that your face is symmetrical. I don't see any bruising, edema, lesions, and you're growing facial hair appropriate for your age. And your face is symmetrical, like I said. Now I'm going to test your pupillary extraocular movements. Can you please follow this pin? Great. Everything is intact. Now I'm going to test your pupillary reflex. Just look at me, please. Great. Your pupils are equal round interactive at 3. Now I'm going to palpate your lymph nodes. Please tell me if you feel any tenderness. This is your pre-auricle, post-auricle, tonsillar, occipital, submandibular, submental. Now I'm going to go with your pre-cervical, post-cervical, and your supraclavicular. Noticing no enlargement, warmth, or redness to any of those. Did you feel any tenderness?
No.
Great. Now I'm going to check your cranial nerve 5 by palpating your masseter muscle. Can you clench, please? Great. I'm also going to feel for your TMJ while I'm here. Noticing no subluxation. Is it tender around here?
No.
Great. Now I'm going to put this Q-tip on your face, testing your sensory function. Please tell me when you feel it, and can you please close your eyes?
Yep. 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 Yep.
Great. Now I'm going to check cranial nerve 7 by having you mimic my face or do what I'm telling you. Can you please smile? Can you frown? Can you raise your eyebrows? Can you puff out your cheeks? And can you do a kissy face? Great. Now I'm going to look inside of your mouth. Can you say ah, please? Great. I'm noticing that your uvula and your soft palate rise symmetrically with phonation. Can you stick out your tongue? Great. It is symmetrical. I'm noticing there are no lesions, nevi, white patches, or abnormal findings. Can you say ah real big?
Ah.
Great. I can't see any tonsillar enlargement. I would rate those at a 0. Noticing your trachea is midline. Your thyroid gland is not enlarged. There are no pulsations of the carotid artery. No thrills felt. I've noticed there are no enlargements or abnormal bumps or bruising. Your skin is well perfused, pink, moist, soft, no abnormal findings. And now we are going to listen over your carotid artery for any thrills or bruises. Great, none heard. Now I'm going to test your arm movement. Can you please flex your arms? Can you extend? Can you hyperextend? Great. Can you laterally rotate? Good. Can you internally rotate? Awesome. Now can you rise against my hands? Great. That is wonderful. Now I'm going to listen to your heart sounds with both sides of my stethoscope. Now I'm going to listen with the bell. Great, no abnormal sounds heard. Now I'm going to listen to all of your lung fields. Just sit there and just take some deep breaths for me. Thank you. Now I'm going to listen to your posterior breath sounds, so just sit up and take some deep breaths for me. Great. Your lung fields sound clear to auscultation, and your heart sounded great. No murmurs appreciated. Can I do anything else for you today, Luke? Great. Thanks so much.